Throughout its long history, PAHO has played a seminal role in the health development of this region, and it remains uniquely placed to catalyze progress in advancing public health.
Health is not a privilege. It's a fundamental human right. This principle has guided our path for more than a century. When 120 years ago, an epidemic brought about the need to create a body, now known as the Pan American Health Organization, to control the spread of diseases from country to country and protect the health and well-being of the people of the region of the Americas. Since 1902, our mission has been to lead a strategic collaborative effort with member states and other partners to promote equity in health, to prevent and combat disease, and to strengthen public health decisions and action through better data and information and sound science.
There is no primary health care if it's not people-centered, and if communities and people are not at the very center.
Today, we celebrate the remarkable milestones in public health that we have achieved together with member states. Since our work began, life expectancy has increased by an average of 30 years in the Western Hemisphere. Water and sanitation services have improved, and health coverage for vulnerable populations has expanded. We have contributed to many regional health achievements, like the elimination of onchocerciasis in Colombia, Ecuador, Guatemala, and Mexico, and the interruption of vector transmission of Chagas disease in 17 countries. For over 40 years, the success of the Expanded Program on Immunization, EPI, has made the region of the Americas a global leader in the elimination and control of vaccine-preventable diseases. We eradicated smallpox and eliminated polio, rubella, congenital rubella syndrome viruses, and the transmission of indigenous measles. Diseases like HIV, tuberculosis, and malaria have been significantly reduced, and we supported the efforts of countries in the region in the fight against the H1N1 influenza pandemic and the outbreaks of chikungunya, Zika, the cholera epidemic, and yellow fever. PAHO's Smart Hospital initiative has enabled Caribbean countries to better respond to the needs of their people during natural disasters.
One of the pluses of the Pan American Health Organization is to be the agent to allow that Pan-Americanism to flourish in health. The Americas represent a unique group of nations, and together there are few things they cannot do.
We are celebrating progress in legislation, the development of regulatory frameworks, and the establishment of fiscal measures to reduce non-communicable disease risk factors. These measures have included taxes on sugar-sweetened beverages, front-of-package warning labels on processed food products, restrictions on the marketing of unhealthy foods to children, and implementation of tobacco and controlled measures.
Los problemas actuales y futuros requieren soluciones políticamente valientes, técnicamente innovadoras y empíricamente eficaces.
But the world had not faced a pandemic like the one brought upon by COVID-19 in more than 100 years. Inequalities were exposed, and unprecedented challenges highlighted the importance of our mission to ensure universal access to health for all. PAHO has worked to increase access to essential health supplies for COVID-19 through advocacy, coordination, and negotiation. Since the beginning of the pandemic, the PAHO Strategic Supply Fund has procured more than $318 million of medicines and other public health supplies and delivered more than 150 million doses of COVID-19 vaccines to 33 countries and territories. The COVID-19 pandemic shed light on the high dependence of Latin America and the Caribbean on the imports of health technologies from outside the region. In a bid to increase local production capacities to tackle COVID-19 and future infectious disease challenges, PAHO launched the regional platform to advance the manufacturing of COVID-19 vaccines and other health technologies in the Americas. With 120 years of experience, our presence in the region is strong. With 27 country offices working closely with member states, governments, partners, donors, and civil society.
Es el profundo convencimiento que tenemos de que la salud puede ser un excelente instrumento para el diálogo, la cooperación y el entendimiento entre los pueblos, los gobiernos y las sociedades.
We are the oldest health organization in the world, founded by individuals who faced enormous hardships, but their devotion to health contributed invaluable successes for humanity. We will continue to foster the spirit of Pan-Americanism, maintaining our commitment to equity and solidarity. We are the Pan American Health Organization, celebrating 120 years of solidarity in advancing health and well-being, leaving no one behind.